We're speaking today with Brigette Ulin, the Director of the Office of the National Prevention Strategy of the Centers for Disease Control and Prevention. Brigette, could you explain to us what the National Prevention Strategy is?
Absolutely. The National Prevention Strategy is America's plan for better health and wellness. It aims to guide our nation in the most effective and achievable ways to improve the health and well-being of Americans. It was actually created by the National Prevention Council, which is chaired by the Surgeon General and was called for in the Affordable Care Act.
How is the CDC involved with this? What is their role?
Well, the Centers for Disease Control and Prevention has many programs that have been working in the area of prevention for many, many years, as you know. My office, the Office of the National Prevention Strategy, which is in the Center for Disease Control and Prevention's Office of the Director, supports the Surgeon General's office in working with the National Prevention Council to prioritize prevention across the country and working with our partners at the state and local level to implement the National Prevention Strategy.
What is the role of the states? How important are the state and the state health programs involved in implementing the National Prevention Strategy?
Well, we know that the federal government alone, can't do this work alone to solve the problem of health and well-being in the United States. So states are a critical partner, in addition to local communities, state and territorial governments as well. And states can do quite a bit to help prioritize prevention. One thing they can do is really facilitate the collaboration across sectors. The National Prevention Strategy is a framework for showcasing how different sectors can work together, such as housing, transportation, education, justice, etc. Those are all the departments that make up the National Prevention Council. So states can really facilitate the collaboration across those sectors. They can also consider health criteria when they're making decisions at the state level.
So it's very much a health and all policies approach, isn't it?
Yeah, we like to refer to it as health and decision making, and really how do you consider health, look at the indicators, and have health partners at the table no matter what sector or what area state's working at. Really considering health and the impact health may have in decision making.
How does environmental health assist in the implementation of the National Prevention Strategy?
Well, environmental health programs are very well positioned to help accelerate prevention efforts. One of the strategic directions of the National Prevention Strategy is healthy and safe community environments. And that's strategic because we know that environmental health plays such a key role and that people's health is affected in where they live, where they learn, where they work, where they play, where they pray, etc., and where they learn. So that is why that is one of the core elements that's throughout the National Prevention Strategy is environmental health.
What tools and resources are available for states that are interested in implementing the strategy?
For state legislatures or legislators, a great resource for them is to actually contact their state health official or state health officer and get local data for their state and learn about the resources available in their state. In addition, the Association of State and Territorial Health Officials just released a web-based resource that can support states on how they can implement the National Prevention Strategy. It showcases how states are collaborating across multiple sectors. It shows the actions they're taking to advance health and well-being in their nation, and it shows how they can align policies and laws that are relevant to effective health strategies.
Do you have any specific examples of states that have implemented the National Prevention Strategy?
Yes, actually, the National Prevention Strategy is being implemented across the country as a framework for accelerating prevention. And in Virginia, the Virginia Health Department has actually funded 38 projects as part of making healthier Virginia a priority. They're actually funding projects to work across sectors to focus on one of 4 specific areas that are highlighted in the National Prevention Strategy. So they're actually requiring organizations to come together across sectors to advance prevention efforts. And one example they're doing in Virginia is looking at schools and corner stores to increase access to healthy and affordable food. So bringing in local farmers and local growers into these communities so that kids in school have access to healthy food and folks in communities where there aren't normally access, so corner stores working with these different partners in the organization to increase that access to healthy and affordable food.
Where can a state legislator get more information about the National Prevention Strategy?
So if they go to www.surgeongeneral.gov, you can find all the information about the National Prevention Strategy, the National Prevention Council, copies of all of the reports that they've produced every year, in addition to other resources and examples of what's happening across the country.
On behalf of NCSL, I would like to say thank you for being with us today.
My pleasure.